Hello and welcome to our lecture on the principles of epidemiology for midwives and other birth workers. It's important for birth workers to be familiar with the principles of epidemiology because many of us are in birth work because we want to improve outcomes for pregnant people and birthing families. And in order to do that, we have to be aware of how those outcomes are measured, how the public health system works, and how to use language appropriately related to epidemiology to engage with other individuals who are interested in improving perinatal health as well. So let's go through some definitions, and we'll try not to make this too boring for you and not to make it too math heavy either. So epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to control health problems. So we can talk about the distribution of health-related events in a population, such as the percentage of individuals in a state who have heart disease. We can also talk about determinants of health-related states or events in populations. So epidemiology can also tell us, for example, the percent of people who do not engage in physical activity on a regular basis in that state as well. And an epidemiologist is one who practices epidemiology. So when we're talking specifically about the epidemiology of communicable diseases, which is what most of us are familiar with, we are talking we can use a variety of different definitions. So an epidemic is an unexpectedly large number of cases of an illness or event in a particular population. So for example, when we see that, for example, the flu, there's a new strain of flu, and it is unusually high, say for example in a particular state, then that could be considered an epidemic because it's unexpectedly large. An outbreak is very similar, except it's typically used for a more limited geographical area. So for example, you might have heard that there was, for example, an outbreak of measles in Disney World. It's a smaller geographic area. Endemic is a disease that occurs at an expected level in a population or in a certain location. So, certain diseases, right? Malaria is endemic in areas where there are mosquitoes that carry malaria. And a pandemic, of course, we've all heard this term many, many times over the past few years, is an outbreak over a wide geographical area. So we often talk about a pandemic when we have an outbreak or an epidemic that spans more than one region of the globe. The history of epidemiology, just a little bit of a history lesson, is it goes back to Hippocrates in 300 BCE, the idea of trying to figure out what causes diseases. And then there weren't that many advances that were made, say, for example, in the Dark Ages, when people weren't really in Europe, in colonial cultures where there was really not a lot of interest in finding out new information. So it really wasn't until the 19th century in England when John Snow became interested in understanding the spread of cholera, and he actually figured that cholera was a waterborne illness by mapping the number of cases of cholera that occurred around specific water pumps in London. So John Snow is often considered sort of the forefather of epidemiology in Western colonial cultures. When we talk about health outcomes, it's important for us to understand the basic mathematics of what we're talking about. And a term that we hear a lot in epidemiology is a rate. So a rate allows for a comparison of outbreaks at different times or in different places. And we use rates rather than numbers because sheer numbers can be misleading. So for example, if someone is talking about 10,000 cases of gonorrhea in New York City versus 10,000 cases of gonorrhea in Albany, for example, that's not really comparable because the population of New York City is so much bigger than it is in Albany, say, for example. And so rates allow us to compare outbreaks in a non-misleading way, in an accurate way. So when we calculate a rate, we look at cases. So for example, people who are sick with a disease or have a particular health issue. And we look at the population at risk, the number of people who are susceptible to particular diseases or conditions. And then the rate is the number of events in a given population over a given period of time. Right? So time is another important impact of rate. Typically, when we talk about a rate, we talk about on an annual basis so that we can compare equally one year to another year. But time is a component. It's important to remember that, even if it's not explicitly stated. So another couple of definitions that I think everyone should sort of be familiar with, whether you are a birth worker or another type of healthcare provider, or even just a consumer trying to understand what's going on with public health, is the term incidence rate and prevalence rate. So an incidence rate is the number of the new health-related events or cases of a disease divided by the population at risk. Right? And this is very important when we're talking about the study of acute diseases. So if we're talking about, say, let's talk about an outbreak of salmonella related to eating undercooked eggs, for example. The incidence rate would be the number of new cases of salmonella in the population over a particular period of time. And it's very similar to attack rate. The prevalence rate is the number of new and old cases in a given period of time divided by the total number of people in that population. And it's usually useful in the study of chronic diseases, diseases that usually last 3 months or longer. And so here is how you would calculate that, right? Incidence rate is the new health-related events over the population at risk during the same time period. Prevalence rate is the total number of individuals who have the health-related event or case of a disease over the total population the same time period. So we can kind of think of incidence and prevalence as filling a bathtub, where incident cases are the new cases being added to the total. Prevalent cases are the ones that are existing, and people who either recover from the disease or who die from the disease are then removed from the equation, right? So say, for example, you have a rate of heart disease here. As new people get diagnosed with heart disease, they're added, right, they're incident cases because they're just diagnosed, and then they become part of the prevalent cases. And then as people either recover or die, the total number of prevalent cases goes down because the population that we're calculating it on also goes down, right? So incident cases, new cases, prevalent cases are those that are ongoing. We can also think about rates as crude rates or age-adjusted rates, and there's different ways to adjust rates. And again, I'm not going to get very math heavy on you. Just give you some highlights here. So a crude rate is a rate in which the denominator, right, the bottom number of the fraction, includes the total population. The age-adjusted rates is used to make comparison of relative risks across groups and over time when a group differs in age structure, right? So a crude rate would be, for example, the number of unintentional injuries, or in this case, let's say motor vehicle accidents, right? We could look at the total population of a state or province or country or region and count how many people got into a car accident and then divide that by the entire population. That would be the crude rate. We could also adjust it by age, and that would help us see, for example, that typically automobile accidents tend to be focused in younger ages. When people are a little bit more reckless, their brains are not fully developed to understand the risks, for example. And then you also see a bump later in the higher ages when maybe as people age, they might not have the same reflexes they had when they were younger. So age adjustment helps us pick out highlights of diseases that might occur at different rates in different age groups. And that's all you need to know. You don't need to know the whole math behind that. So we know, especially those of us who are midwives, that reporting of birth, deaths, and diseases is an important contribution that we make in terms of public health surveillance or epidemiology. So in the United States, physicians, clinics, hospitals are required to report births and deaths and reportable and notifiable diseases, and so are midwives and other healthcare providers. So reportable diseases are diseases of local public health concern, and those are designated by states in the United States. Notifiable diseases are conditions that warrant monitoring. So for example, if we see an outbreak of something like monkeypox, for example, that might be a notifiable disease that the CDC wants to keep track of. So reportable diseases and notifiable diseases may be slightly different depending on where one lives. And data from the United States is shared with the World Health Organization. The CDC also puts this data into a database that people can access, and they summarize it in a weekly journal called the Morbidity and Mortality Weekly Report. So here's a picture of the notifiable disease scheme, reporting information to the local health department, which goes to the state health department, which goes to CDC, which goes to the World Health Organization. So all of us who may have to report diseases or monitor notifiable diseases contribute to this scheme. So I'm going to stop right here, and then we're going to pick this up in another short video.